Hello everyone, I'm Mariam Thomas Oommen, a social work trainee from Rajagiri College of Social Sciences. I'm here to give you all a brief idea about AIDS, an endemic that has affected different parts of the world, causing a decrease in life expectancy, overwhelming healthcare systems, and deterioration in the child survival rates, and many more. AIDS, that is acquired immunodeficiency syndrome, is a fatal illness caused by a virus, HIV, human immunodeficiency virus, which compromises the body's ability to fight diseases. Though AIDS and HIV are often heard together, they are not the same. A person has AIDS only in the final stages of HIV, after the immune system becomes unable to defend itself. HIV attacks the white blood cells called CD4, whose main function is to fight diseases. When CD4 drops, one tends to be more susceptible to diseases. The only ways in which HIV is transmitted are through sexual transmission, maternal fetal transmission, and through having direct contact with infected blood, that is, by sharing injected drugs, needles, and by blood transfusion. Do note that HIV is not transmitted through any other ways such as hugs and kisses, mosquito bites, or by using the same toilets. HIV/AIDS is most common in sub-Saharan Africa, with more than 2/3 of all people living with HIV globally, followed by Asia and the Pacific. People living with HIV is estimated in the map according to the 2018 UN AIDS report. In order to diagnose HIV, there are screening tests. ELISA is a sensitive test used to detect antibodies, and Western blot is a confirmatory test. Also, nowadays there are HIV self-testing kits available in the market. Now coming to the treatment of HIV or AIDS. Till date, no vaccine has been found to prevent HIV or AIDS, and it has no cure, which is all the more reason why we have to work together to prevent it and end it. However, the main treatment for HIV is antiretroviral therapy, a combination of daily medications that stops the virus from reproducing. People who are at a high risk of being exposed to HIV are truck drivers, sex workers, and mostly MSMs and transgenders, clients of STD, migrant workers, people who inject drugs, and blood transfusion recipients. Some of the ways in which we can reduce the risk of acquiring HIV are by talking to your partners and getting tested, using condoms and practicing safe sex, getting tested and treating for STDs if needed, talking to your healthcare provider, avoid sharing razors and toothbrushes, and if you do drugs, use sterile equipments and refrain from sharing it with others. Although it has no cure, there are ways to prevent it, providing health education to people to enable them to make life-saving choices, offering combination prevention programs such as needle and syringe programs, opioid substitution therapy, by urging people in high-risk groups to refrain from donating blood organs, sperms, and tissues, and by sticking to the sterilization practices in hospitals and clinics. In India, National AIDS Control Program was formulated by the Government of India in 1986 with the overall goal of halting and reversing the epidemic in India by integrating programs for prevention, care, support, and treatment. Some of the programs are condom programming, blood safety program, information, education, communication, and social mobilization, targeted interventions, NGO activities, voluntary counseling, and testing. Thank you for your patient listening. I hope you have a basic understanding of AIDS, and make sure you share it with others. Let's dream big, let's work together, and let's end it.